Hi there, I'm Lucy Macdonald, physiotherapist. Welcome back to my virtual clinic. Today, I'm super excited to be introducing you to Dr. Brinda Christopher, who is a sport and exercise medicine consultant in London. She's going to be talking to us all about vitamin D. So, Brinda, just before we get cracking, is there anything that you'd like to add?
Hi, first of all, and no, you've introduced me perfectly. And it's just to say that from a vitamin D perspective, I'm purely coming at it from a musculoskeletal injury point of view. So how do we optimize our healing when we have musculoskeletal injuries? I'm not an endocrinologist or a rheumatologist, so I won't talk about other aspects of immune response to vitamin D or even osteoporosis. It is simply from a sports medicine background.
Excellent, excellent. So let's get started with the basics then. So what is vitamin D?
So vitamin D is rather interesting because I think actually we start with a misnomer. Everyone thinks of it as a vitamin. But I like to explain to patients that actually it's sort of a precursor to a hormone. And we all know, or a precursor to a steroid, say, for example. And we all know what steroids can be used for in the bodybuilding world. And if I sort of talk about it in that way, I think they then understand the importance of why I want to test for it, so a blood test, and then optimize it with advising sun exposure, or if we're in the winter months, then tablets. So in the medical world, it's sort of known as a precursor or a pre-hormone.
Okay, so for those that aren't familiar with the world of steroids for people trying to build muscles, could you give a bit more information about that? So when you say it's a precursor to hormone, what does that mean to people that don't have any kind of exercise background?
Yeah, so I think you've sort of touched upon it. It's to do with the world of doping or trying to get excessive gains. And we know that people will take steroids to have additional gains to their training, so to put additional muscle down. And in the world of elite sport or professional sport, we actually have doping regulations to make sure that they aren't abusing substances, but I mean, there are many infamous cases where individual athletes have doped. They may have taken steroids. They're performance enhancing. So I sort of like selling it to them in the way that, it is sort of performance enhancing, but it's not illegal or
it's not illegal. No, exactly. So it's not actually a steroid. Quite. Okay, brilliant.
No, but there are naturally occurring steroids in the body. So it is a precursor to one of those, really. I think maybe it's an unhelpful or oversimplistic way of explaining it, but I mean, I prefer steroid as opposed to hormone because, as quite rightly point out, I think many people won't know what a hormone is. But if I can then draw a parallel or a comparison to bodybuilders and look, they boost or they take steroids.
I think that is helpful for our viewers. So yeah, thank you. And you touched on it a minute ago, but where do we normally get vitamin D from?
So there are food sources and there are UV sources, meaning the sunlight. So if you live at the equator, you get maximum exposure. If you live at a latitude of Rome or below, you get year-long useful UVB rays for your skin.
I'm off now.
For your skin to make, vitamin D. The problem with you and I is that we live in London. And aside from the cloud or the reduced sort of daylight hours, we're living at the wrong latitude for year-long round useful UVB. So that's why I may move to Rome soon.
Yeah, I'll come with you. So what is there a proportion of the year where we do get vitamin D from the sunlight?
So in England, I broadly say March to October. I think that's a good enough window for you to then be aware and then make sure that when you're going out, and I often say mid-morning sun, And that's to balance and to make sure we're not exposing you to unnecessarily harmful rays, which will increase your risk of skin cancer. But mid-morning sun, so 10 a.m., 11 a.m., coffee break time, if we've just sort of planted a seed for you to go out and roll your sleeve up, just unbutton your shirt a little, and make sure that you're getting 10 minutes. 10 minutes daily should be sufficient.
Brilliant, really helpful.
But be aware, especially with women, it's not only clothing that can be a barrier, but it's actually, there are hidden SPFs in moisturizers. Obviously, makeup adds another layer. So if your face is covered in makeup, then maybe it is your neck and your arms that are going to be more useful for you to expose.
Really helpful, really helpful. And then what about in winter then? What do we do if we're north of Rome and we have a long winter?
So I jokingly advise patients that if they're going to put money aside for a holiday, to prioritize winter sun holidays. So I'm a huge advocate. I think aside from that, I think England's so beautiful during the summer. Why would you want to miss out? And travel as soon as October or November, December comes along? So yeah, and then I've touched upon the fact that you can get vitamin D through the diet, but we're not really sure how much or of each, whether it's dietary or skin exposure, that contributes to serum, meaning your blood levels. So if you've got a musculoskeletal injury and it's during the winter months, then I do like to test to see where we are. If you've been good enough and you've managed to boost your levels in the summer months, you should have sufficient stores to then last you during the winter months. But if you have been working in an office, for long hours, even during the summer months, and you haven't consciously sort of gone out, had a coffee break in the sun, your levels may be low, so it's worth testing.
Okay. So I might come back to what symptoms would mean that people need to go and get tested in a minute. But before we move on to that, you said some foods. What kind of foods have vitamin D? I know you said
there's naturally occurring vitamin D, and then there are fortified sources. So I think the turn of last century, maybe in the 1920s, governments realised that there was a link between rickets, so vitamin D deficiency states, and bone health. So if you have a look at cereals, I think on the back of packets you'll see that lots cereals have been fortified. Vitamin D is a fat-soluble vitamin, so I would advise just generally not to exclude all fats from your diet. And then egg yolks, oil fish, those are the kind of foods that you can, mackerel and things like that you can get vitamin D from. But as you appreciate, there's only so much of that you can eat. So I really do think that I prioritise skin exposure to sun as opposed to food sources.
Yeah, really helpful. Thank you. And coming back to that, the thing we touched on a second ago, how could people know that that their vitamin D levels are low? Is there anything that they would feel or notice in themselves?
Yeah, so I mean, I don't want to speak too much about non-musculoskeletal vitamin D symptoms, because as a sports and exercise medicine consultant, I really feel as though I'm only in a position to talk about injury, prevention, and optimization of the healing process. But there are theories out there that you are more prone to coughs and colds during the winter months, perhaps because you're vitamin D deficient or insufficient, because you're running low, and that's what makes you more vulnerable. And also that lethargy that we talk about, especially during the winter months, of struggling to get out of bed, despite having your 8 or 7 hours sleep, whatever you have put aside for yourself and you're taking on a regular basis. This lethargy, this unshakable lethargy, and often you find that patients, I think general practitioners will speak about this, that patients do respond really well to vitamin D supplements, and even if it's a low dose over the counter, there seems to be just this turnaround. So I wonder, but it's not my area of expertise, but these are generally the symptoms. I think it's the symptoms that we're all familiar with living in at this latitude. during the winter months. Maybe it is because of vitamin D insufficiency.
So if you are feeling fatigued, excessively fatigued in a way that a decent night's sleep isn't enabling you to recover, then perhaps go and see your GP and have, is it a standard blood test or what? Do just explain, obviously your GP will choose, but I guess they then do a blood test, and then what are the normal levels? Because I know there's some controversy, we've talked about this in the past, there's some controversy over what normal is. It can vary from country to country for a start.
So, I mean, firstly, I want to say I don't want people rushing to their GPs requesting vitamin D tests because they're suffering from, the winter months blues. I think a first sensible step would be to go to your pharmacist and ask for 1,000 international units supplement, and you can take one of those a day and see how you feel. As long as you don't have any pre-existing medical conditions, I think that's a sensible first step. See how you feel after a month or 2 months of taking that. Do a bit of background and detective work yourself. I think on the NHS it changes from time to time, and we don't want to overly burden GPs with something that you can sort out yourself, because I don't think they will necessarily provide you with a blood test. It depends whether you've got pre-existing conditions, whether one is connected to the other. Often, and I'm going off track here slightly, but often when you're a young woman, if you've got heavy periods, I think that's reason enough to do a blood test, because you're worried about iron deficiency states, which can be, you can replace your iron or consume foods that are rich in iron. With vitamin D, I don't know whether it's the same thing. So I think it would be most sensible, if you have those symptoms, to start 1,000 international unit supplement daily and take it for a month every day and see how you feel. If you feel as if you're responding great, if you don't, or if this lethargy is problematic, if you aren't sharp enough during the day, if you're falling asleep during the day, go see your GP, of course. But I think it's simple enough that you can manage yourself.
And I know one of the things that people can be concerned about is overdosing with vitamin D. With those sorts of levels of supplements, is it possible to overdose? Talk to us a bit about that.
Sorry, and I realised that I haven't answered your previous question. So there were so many questions
rolled into one.
I should
don't worry.
Down. But so no, the 1,000 international units daily is a safe enough dose that you can take without having blood levels taken. There are states in which you can overdose, but when it comes to a prescription type grade or level, if you come see me, I can give you in the region of 40,000 international units for the week, in comparison to what you may take if you self-direct, which is 7,000 international units that week. So big difference. And I would be confident enough to prescribe you that only if I have some serum levels. Again, by the time you get to me, I'm secondary care, I'm not your GP. You're seeing me for another reason, which is a musculoskeletal injury disorder or failure to heal. And we're thinking outside of the box, trying to optimize healing. So different reasons for supplementation here. So general well-being, lethargy, winter blues, 1,000 international units is fine. Anything more, and in our case, if it's a musculoskeletal injury, I'll do your blood tests and you'll receive a level. So in elite sport, I would like to say we would like to aim for levels of 100 and over. Having said that, though, if on a primary care level, if you go to your GP, GPs will happily sit on, say, 50 in a normal population because that's considered normal. But you have to appreciate that the demands in an elite athlete are quite different. And the demands in somebody who has a musculoskeletal disorder are different. So we have to make sure that we're defining our population. So if it's just lethargy, it's completely separate. 50 probably adequate. But if you've got a pre-existing condition that requires some additional help and support, I would usually aim for over 100, but your GP won't necessarily supplement you to those levels.
And if you
it's commonly,
yeah, go on.
I was about to say, you can commonly see levels of 20, 30 in the winter months. You know, the darker your skin, so the thicker the, I think, dermis or epidermis are, and the harder it is for the UVB rays to penetrate to the layers where it's required to synthesize the vitamin D. So darker skins, or people who cover up, or office workers, those are sort of risk factors for not getting or boosting your levels to the appropriate levels in the summer months.
Okay, really helpful, thank you. And we've got, I know you see a lot of elite athletes, but I know that you also see a lot of amateur athletes who are, or people that like just doing a lot of sport. And and I know there's a lot of people that will be watching this who are in that category, not necessarily professional athletes, but certainly they like doing a lot of sport. If you're someone who keeps getting lots of little injuries here, there, and everywhere, and perhaps you're not recovering like you normally would that be a sort of person that you might look at their vitamin D levels, amongst other things, I would imagine?
Definitely. I think it'd be sensible enough if you have recurrent injuries, again, to think about what's causing this. In medicine, we talk about one unifying diagnosis rather than lots of separate ones. And so vitamin D deficiency could have a part to play, especially if you're an amateur athlete or a semi-pro. Your requirements of nutrition and sleep are slightly higher, and in a similar way, vitamin D requirements are slightly higher than the average population. So it could be argued that it's more important to replace or to test.
It's certainly something that I notice with marathon runners, so particularly people who aren't repetitive marathon runners, but perhaps people that are doing it as a one-off, that they focus a lot on the protein intake and the carbohydrate intake, but perhaps forget about all the other little building blocks, vitamin D included in that they need to be thinking about taking on more of as well. And I suppose at this time of year, when we've just had the virtual London Marathon, people with sort of bony stress injuries and stuff, what would you, any comments around sort of bone stress fractures, that sort of thing, and vitamin D? And then we might need to wrap up, because I know you and I could talk about this for a long time, but so go on, tell us a bit about
stress injuries. I think that's really important. So vitamin D is used for muscle, ligament, tendon, bone regeneration. It's all part and parcel of some sort of a hormonal axis. So that's why it's so important to take vitamin D level as well as other blood markers such as calcium and parathyroid hormone, because the three of them are interlinked. And so for all of those amateur athletes, I wouldn't go out there and just put yourself on the higher dose replacement, because it's so important to make sure that we're not causing any problems. So we need to make sure that we've got the blood tests, everything's okay, we supplement for 6 weeks and then we retest. You asked a specific question that I've forgotten about, but so even with stress fractures, I think it's really important. It's my normal practice to check vitamin D, because again, it's just an easy win. If we find that they're deficient, you're like, boom, there we go, we'll replace and hopefully get you back on your way. Your body obviously is struggling to heal. So stress fractures are the fact that the bone is an organ, it's living and it's breaking down and it's building up every day, every hour. And usually in a healthy population, it's at an equilibrium. But stress fractures are when there's an imbalance. So it's breaking down more than it can build up or back up again. And so why is it breaking down more? Why is it unable to build back up? It could be down to a vitamin D deficiency or calcium, or, within that complex pathway or axis.
It's so brilliant to talk to you, Brinda. You are, as ever, a wealth of knowledge, and you're amazing at explaining what are incredibly complex things in a very simple way. So thank you very much. I'm sure our viewers appreciate it. I think it's probably time to start to wrap up. Is there anything else that you'd like to add before we say goodbye?
I mean, you're right. You can talk about vitamin D for quite some time. I think my take-home messages are, especially if you're training, is that winter sun is key. So travel in the winter, get that sun exposure, you will feel better, and you might even notice that your ability to deposit muscle is better too. And it's just to fine-tune your brain. It turns out that how you feel the next day is a good indicator of whether you're well rested and the rest of it. And I think likewise with vitamin D exposure, you just feel happy. The sense of euphoria in the summer months, I don't think is down to, you know, the warmer weather. It probably is down to the fact that you're being exposed to this happy hormone like vitamin D.
Brilliant. That's so brilliant, and thank you again. It's been as ever an absolute pleasure to talk to you. If any of you would like to get in touch with Dr. Brinda Christopher, you can email her. I will put it in the comments underneath this video, but it's christopher.admin@lips.org.uk. If you want to get in touch with me, it's lucy@octopusclinic.com. So thank you all for joining. I'd like to say thank you very, very much indeed to Dr. Christopher. I really do appreciate you spending your time and sharing your knowledge with us. So thank you very much, and I'm sure all the viewers are very grateful too. So it's time to wrap up. So if you have any topics that you would like me to cover, please do let me know. Don't forget to subscribe, and I look forward to seeing you next time. Bye.